Do we have anything that's specifically addressing her complaint? Anybody? Is she on anything that's specifically addressing her complaint that's inadequate? So she's complaining of intermittent pain, right? And difficulty walking very far. Is she already on anything that might be inadequate? We indicated that her statin therapy is probably subtherapeutic for the indication, but what about, does she need to be on the hydrocodone? Could that have been prescribed for what kind of pain?
Her lower extremity pain.
So what was the indication for the hydrocodone?
Diabetes pain?
It just says pain.
Neuropathic
Maybe
pain?
I don't recall seeing it, so I think I would want to know what the indication for that was. It's got a high addiction potential, and that could increase her risk for falling if she's got inadequate circulation in her legs. So I would want to clarify what the purpose of that was. If it's for her claudication, that's completely inappropriate.
Okay.
It's just masking the underlying disease state, and it's not addressing it. So, all right, I'm going to be quiet, and we'll go to the next
The risk factors she has are dyslipidemia.
Signs, symptoms, and laboratory values.
Sorry. Numbness when she's walking, pain while she's walking, and it tends to get better when she's resting or elevating her feet.
Anything else?
ABI. Yeah, the ABI values. Indicate moderate.
So one of the diagnostic tests is the ABI. That's the gold standard for detecting. It's got a high specificity and sensitivity. The problem is there are certain populations it's not very effective for, and that's patients that have the calcification of their arteries. So the older we get, the more arteriosclerosis that we get, the less compressible the arteries are, so you can get abnormally elevated pressures in the legs for comparison. So it would look like you have a normal ABI, when in fact it's highly abnormal. Inside the artery, they may have very small patency. The interior diameter with all the plaques may be very, very small. So the other test that we could do is Doppler. And Doppler is different from ultrasound. Ultrasound is using sound waves to detect differences in solid matter. So
I know your moustache. From the papers.
Tissue and
You're the detective, Hercules Poirot?
Hercule Poirot, I do not slay the lions.
That will show a different sound signature when it bounces back.
Mary Devlin, monsieur. I'll forget.
Doppler, on the other hand, is an ultrasound that can detect motion. Regular ultrasound cannot detect motion.
Peripheral arterial disease, also known as PAD.
How blood is moving through valves.
That is the buildup of cholesterol plaque along the walls of the arteries supplying the lower extremities. This causes different symptoms. The first symptoms we see in patients are that they have what's called claudication, which is pain, tightness, or tiring of muscles after you walk a certain distance. And depending on where the vessel is narrowed, it can affect different muscles. So sometimes people will have pain in their buttocks, sometimes in their thigh, sometimes in their calf muscle when they walk a block or two. In more severe cases, if the blood flow is more compromised, people can start having pain and numbness and tingling in their feet at rest when they're not even moving. And in more advanced cases, you might even have some tissue loss, like an ulcer in one of your toes or even gangrene. The treatment of this PAD is to restore blood flow to the lower extremity. And there's both minimally invasive techniques, which I perform, as well as open surgical techniques, which are done by a vascular surgeon. The minimally invasive techniques using catheters, which are little tubes, we navigate through the bloodstream under x-ray guidance and inject dye so that we can see under the x-ray guidance. And then we go and open up the artery with different kinds of miniaturized tools. One of them is called an angioplasty balloon. It's a balloon that goes and stretches open the artery, and it pushes the plaque to the side so that you can have normal blood flow through the area. Now, sometimes that's not effective, and we'll leave in what's called a stent, which is a tubular metal mesh-like device, and that actually holds the artery open and pushes the plaque to the side. There's another type of procedure called atherectomy, where a device goes in and removes the plaque from the body, and it might do that by shaving it off, kind of like a cheese cutter, or it may put a little tiny burr, like a drill bit burr that spins so fast that it pulverizes the particles. Sometimes we'll inject some clot-busting medications. That's called thrombolysis. Now, let's say that I can't restore blood flow with minimally invasive techniques. In that situation, you may need to have open surgery. So you go to the operating room, and there a vascular surgeon can do a couple different procedures. One is called endarterectomy, where they actually cut out the cholesterol plaque and remove it. And the other is bypass surgery, where a tube, which can either be a synthetic tube that's ordered as a product from a shelf, or you can use your body's own pipe, so to speak, like using a vein, and you bypass the blocked off area. The bypass is done from an open vessel past the closed area to the next open vessel. But that's done by a vascular surgeon in the hospital in an operating room, and it's a much bigger procedure than the previous minimally invasive techniques that I talked about.
Any other goal? To get us to our overall goal.
With peripheral vascular disease, vascular refers to the blood vessels, and peripheral means the outer limits or edge of something, which in this case refers to essentially any vessels that aren't supplying the heart or the brain, like the legs, arms, or other organs. Peripheral vascular disease is when one of these arteries becomes narrowed, which reduces blood flow, and this often affects the limbs. Peripheral vascular disease, or PVD, usually involves the arteries, and so sometimes it's also referred to as peripheral artery disease, or PAD. PVD is most often caused by a blockage called organic PVD, most commonly caused by atherosclerosis, which is a buildup of lipids and fibrous material just under the inner lining of the blood vessel, called the tunica intima. When plaque builds up, it narrows the artery, which reduces perfusion to whatever tissue it tends to supply. This buildup usually happens over the course of years. Also, though, the vessel could be blocked by an embolus, which can happen suddenly if a blood clot from some upstream artery lodges in a peripheral artery, which obviously stops blood flow from getting to the tissue the vessel supplies. Besides organic PVDs, though, there are also functional PVDs, where blood vessels stop blood flow by changing diameter, like with vasospasms, where the vessel constricts and blood flow is reduced. This type is usually short-term and can come and go. Alright, so the most commonly affected vessels in peripheral vascular disease are the arteries supplying the legs. So when less blood gets to the muscle tissue in the legs, that tissue sees less oxygen and becomes ischemic. Ischemic cells release adenosine, a type of signaling molecule which is thought to affect nerves in these areas, which is felt as pain. This pain in the legs is often referred to as claudication. Sometimes, even though it's narrowed, at rest, there's enough blood to meet the tissue's demands, and many people are usually asymptomatic. But if that person is walking or exercising, then the leg muscles start to work harder and demand more oxygen. So demand becomes greater than what's being supplied, which causes the claudication or pain. The location of the pain is a clue on which artery is involved. If it's the hips and the buttocks, think lower aorta or iliac. If it's the thigh, then think iliac or common femoral artery. For the upper 2/3 of the calf, the superficial femoral artery. The lower 1/3, the popliteal artery. And finally for the foot, think tibial or peroneal artery. Other symptoms include leg or foot wounds or ulcers, that don't heal up normally, as well as color changes of focal areas of the skin. So for example, if the leg's been affected, the foot might turn pale white when it's raised, called elevation pallor. Since gravity is sort of working against blood flow to the lower extremities, which already has a hard time getting through that narrowed artery. Likewise, the foot might turn red when it's lowered, called dependent rubor, since gravity is now working with the blood flow. We can see that gravity seriously starts to affect blood flow in the affected arteries. As that arterial blockage gets bigger, less and less blood gets to the tissues, which can lead to more serious complications. First, rest pain describes a continuous burning or pain in the forefoot and toes when the legs are elevated, and then the pain is relieved when they're lowered, like hanging the feet over the bed or walking around the room, which allows more blood to get down to the foot. If the blockage is severe enough, then the limb might be at risk of gangrene, death of the tissue, because without oxygen for long enough, the cells can actually die, or necrose, in which case the dead tissue would likely have to be removed, and in some cases the limb would have to be amputated. The major risk factors and causes of peripheral vascular disease are the same as those for atherosclerosis. The same process that, if involved in the neck arteries, can cause a stroke, and if involved in the coronary arteries, can cause a myocardial infarction or a heart attack. Smoking seems to be the biggest contributor to PVD, but other diseases and conditions are also linked to higher risk of PVD, like diabetes, dyslipidemia, or an abnormal amount of lipids in the blood, and hypertension. Diagnosing PVD usually involves listening to the pulse in the iliac arteries of the legs with a stethoscope. Since that artery's been narrowed, it can make a whooshing sound, called a bruit. Another test that can be done is a Doppler ultrasound, which is a non-invasive way of visualizing blood flow. The most common test, though, to diagnose peripheral artery disease is the ankle brachial index, or ABI, where blood pressure is taken in the ankle and in the arm, and then compared. Peripheral artery disease is typically diagnosed if the systolic blood pressure in the ankle divided by the systolic blood pressure in the arm is less than 0.9. In general, claudication is often seen in people with an ABI between 0.4 and 0.9. Rest pain is seen between 0.2 and 0.4, and tissue loss, ulcers, and gangrene between 0 and 0.4. Treating PVD often requires significant lifestyle changes that address the underlying risk factors, like quitting smoking, for one, as well as adopting healthy eating habits and exercising regularly. Alongside these, though, sometimes people with PVD will also get certain medications that typically aim to reduce the likelihood of blood clotting and obstruction of the blood vessels. Surgical intervention like angioplasty or bypass surgery is rarely needed.
Angioplasty?
Thanks for watching. You can help support us by donating on Patreon or...
Annabelle, you got a cough this winter?
May I suggest
Tough love. Mental.
Open surgical techniques, which are done by a vascular surgeon. The minimally invasive technique, and inject dye so that we can see under the x-ray guidance. And then we go and open up the artery with different kinds of miniaturized tools. One of them is called an angioplasty balloon. It's a balloon that goes and stretches open the artery, and it pushes the plaque to the side so that you can have normal blood flow through the area. Now, sometimes that's not effective, and we'll leave in what's called a stent, which is a tubular metal mesh-like device, and that actually holds the artery open and pushes the plaque to the side. There's another type of procedure called atherectomy, where a device goes in and removes the plaque from the body, and it might do that by shaving it off, kind of like a cheese cutter, or it may put a little tiny burr, like a drill bit burr that spins so fast that it pulverizes the particles. Sometimes we'll inject some clot-busting medications. That's called thrombolysis. Now, let's say that I can't restore blood flow with minimally invasive techniques. In that situation, you may need to have open surgery. So you go to the operating room, and there a vascular surgeon can do a couple different procedures. One is called endarterectomy.
What angioplasty is, they insert a balloon in the middle, blockage in, force it open.
And they put a stent.
And then they end up going to surgery for a bypass, just like they would if a PCI.
Non-cardiac percutaneous transluminal and artery blocked by atherosclerotic plaque. Fatty deposits called atherosclerotic plaques can build up inside your arteries, narrowing the passageway and interfering with blood flow. This arterial blockage is called stenosis. Insufficient blood flow to a tissue generally causes pain. A non-cardiac percutaneous transluminal angioplasty is only done when your condition has not responded to less invasive treatment options. X-ray images of many parts of the body from multiple angles. Your doctor will numb your skin around where the catheter is to be inserted. Since the arteries of the leg are most easily accessed, the femoral artery fluoroscope to take X-ray images called angiograms, which let your doctor identify the exact location of the blockages. Next, your doctor will move the catheter until the deflated balloon at its tip is positioned at the site of the stenosis. Then, by rapidly inflating and deflating the balloon, your doctor will gently push the plaque and vessel wall out, partially re-establishing blood flow. This procedure may be repeated for any additional blockages. In some cases, your doctor may place a stent, which is a wire mesh that remains in the artery to hold it open. To perform this procedure, your doctor will place a collapsed stent over the deflated balloon on the tip of the catheter. When the balloon is inflated, the stent expands and locks into place. At the end of the procedure, your doctor will remove the catheter through the original insertion site. After your procedure, a pressure bandage will be applied to the catheter insertion site, and you'll be asked to lie still to prevent bleeding. You will be carefully monitored in the recovery area to be sure blood flow through the affected artery is maintained. Most patients are discharged the same day as their procedure, but some remain in the hospital 1 to 2 days for observation.
I'm not certain that there's a whole lot here that's not that's testable that isn't part of the hypertension and the lipidemia projects. It's just the application to this system of medicine and the consequences.
pulse, and she gave us a pulse, which was 53 beats per minute. But then the pulse was like 130, and I wasn't sure which one to record as the heart rate. So I did the 53 beats per minute because that was a rate. But I'm not sure if we need to do the pulse. So we're just looking for.
Was
Is
one
it
of